we're doing our mandatory department-issued policies, procedures, which is really OSHA. As we know, OSHA was always universal precautions. Wash your hands, wear gloves and masks. But really, OSHA's become much more COVID-19 prevention, and we have to do tuberculosis prevention as well, since now we're just signing slips as you do a two-step and do a thing every year. You sign the thing, because the tuberculosis in this country has really been very, 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 very low. So that's pretty under control, but we still have to be mindful of that, since we're only signing off on forms so we don't have symptoms or get exposed. Just the latest, Claudia's going to be doing the in-service on the latest COVID and OSHA precautions. I just wanted to give everybody the latest updates on COVID-19 from the Department of Health, which I have to deal with, and just some of the OSHA things that just came out yesterday. They're making agencies and providers do a lot of documentation about things. So we're working on that. I think that they've been working on this a long time. So the stuff we have to do is kind of crazy because the world's changed since then. So we're trying to navigate through that. But the latest with COVID, they're saying if you have been vaccinated and it's been the 2 weeks since your second vaccination, that you are safe to travel. They said to still, be cautious, but you are safe to travel, especially when you're with other unvaccinated people, and that to enjoy yourself. What they're finding is, though, for people who are unvaccinated, the rate of infection right now is as high as it was in January, which was very high, because there are two variants, new variants that are very expedient. They hit people hard and fast, and they're hitting a lot of younger people now, 20s, 30s, because the older people are vaccinated. So be very careful if you have chosen not to be vaccinated, that infection rates are extremely high. And the part I was really curious about, because it was a little gray and it was too early to tell, because we're serving the vulnerable population, I wanted to know, I know that these vaccines are very effective, they're like 95% effective, and as you can see, people have been very safe. There's nothing really wrong. So I said, well, what about that other 5%? So though the figures are very good, it's still a little too soon to say. So far, so good. How it will affect somebody that's immune compromised. Cancer, autoimmune things, HIV, there's a number of conditions that still make somebody rather susceptible to this virus. So right now, it's panning out okay, but it's not been that long. We still need a little more time to get that data. So if you are living with someone who's immune compromised or older, or has a condition like heart condition, diabetes that are not very controlled, bad hypertension, they're still at risk. So you have to make sure that you're careful. I mean, live your life if you're unvaccinated, you're pretty safe, but remember other people. I know when I go into a store now, I've been vaccinated since February, I still put my mask on because there's a little old lady there I don't want to scare her. I didn't know if she was, and it's not a big deal for me to put it on. But the important thing is that the Department of Health, we are still listed under healthcare facilities, even though we're home care. I'm trying to get healthcare setting defined, because are people's home a healthcare setting? This is the big question. But we are still mandated by the Department of Health to wear our masks, wash your hands, and wear gloves in patients' homes. So when we're providing patient care, we still have to be wearing our masks and gloves. Now, I had a good question if someone's vaccinated, and they have some vaccinated clients, which some of you do. And they said, well, the client's comfortable with it, so she said, you don't have to wear your mask. I mean, I can't really argue with that, but I don't know what someone else in the family might feel about that. So if that client were to get sick, they might say, was the aide not wearing their mask? And considering the Department of Health is still saying that we do have to wear them, I say we're just safest to do that while you're providing care. I know summer's coming and that's not a great thing, but it is always what we should be doing anyways. We're always masks and gloves in our business and washing your hands. That's basic OSHA. So that is the latest from the Department of Health. If that changes, I will certainly update you, but we are still mandated to wear masks and gloves when we are in people's homes. And just be careful if you are vaccinated, you're pretty free to go. but think of others around you. I mean, that's what I do. You know, I try to worry about, I didn't want to worry the two, you know, elderly women who were next to me in the store who had their mask on. So I just said, I don't know if they were vaccinated. I'll put my mask on. You know, but, you know, that's a personal decision. But that is the latest, and Claudia will take it from here. Thank you.
Okay. Well, many of you have been with us for a long time, so OSHA is like something we do every single year. It usually was in September, but here we are in June. I'm going to get you involved with this because I think it'll be more interesting to everybody. And I have some papers, things. I'm one that collects articles along the way. And Sharon, I'm going to ask you to look at that article. I think the first paragraph will tell you exactly what it's about, and then tell us the year.
Outbreak, the remake,
Yes,
1995.
yes, 1995, it was a movie. And the title of it was
Outbreak.
Outbreak.
That's the one.
Yeah. So it just isn't a new topic. And of course, you all knew that. And here's the
No.
next one. Are you okay with it
No.
without your glasses? No. Okay. And then I'll move on to Connie. Because I know Pam just is in the middle of some eye treatment, so I can understand that. Okay, Connie, what's that topic about and what's the year?
Let me see, avian flu mutate into a pandemic, will it? Let's see the year.
Now, did everyone hear her? What she said? The article?
Indian flu.
The avian.
Avian flu.
They called it like the bird flu or something?
Yes,
Yeah.
exactly.
Will it turn
And that
into
was from CEU and Nurses paper.
I'm trying to find a date, hold on.
Where isn't that, Claudia? I can't see it.
Yeah.
Let me see, November 2nd, 60% fatal. You know what, was it like 2009?
No, the date is there. The date is on the paper.
2005 at the bottom.
2005.
Yeah, November.
Okay.
Yep.
So it seems like there have been some things about this along the way. Okay, Charmaine?
On virus, oh, where?
Time Magazine.
Yeah, okay, Time Magazine, and this is March 30th, 2020.
Yeah. So in other words, not this March, but last March. And what did I highlight?
Test for our shape, humanity.
A test for our shared humanity. Denise?
Really? Coronavirus?
And what's it called?
Oh, survival guide.
Okay.
And it's 6/8/20.
Okay, so that was June a year ago.
Yeah.
And what was the
Are
direct?
you ready? How to protect yourself?
And
What's this one? Each person with COVID-19 could infect an estimated 2.5 people without containment. Each cycle takes 2 to 14 days, and that's on 6/8/20.
and if you want to just turn it around to kind of show the graph, how the infection continues to spread to how many more people as we actually had on our news daily. I know my son lives out in Denver, Colorado, and he was questioning, you know, Midwest, they spend a lot of time Rocky Mountain National Park. But I said to him, no, the statistics are real. You know, when they're reporting in the evening news how many people have been hospitalized or passed away. So, Elizabeth.
People
Now I'm old, so I get that.
the new normal, how the coronavirus is Redefining Life for Older Americans. And the date was June 2020, last year in June.
So it was already becoming clear that there were going to be some significant changes. And we take care of older individuals, and some of us are getting there themselves. Now, I get time because I don't have cable and I don't have newspapers anymore. My father always got the Bulletin, Wall Street Journal, you know, it was something people did back then. And my June 21st edition, 2021, will never be the same. And we won't, because this was like something we never had really gone before. We had touches. There were possibilities. The Ebola, the bird flu, but this really said to us what possibilities can be now and in the future unless we handle it different. And the fact of the matter is, we knew all about this. This was nothing new. We've been talking PPE for years. So, you know, Charmaine, Tim, Denise, Elizabeth, some of the ones that have been with us along the road here for a while, and Connie now knows very true for just her shorter experience with us. You know, aprons, gloves, we are custodial, we clean bathrooms and kitchens, we know how to clean services, and we know why. There have been a lot more articles about that. I mean, it's kind of reminiscent of the old 1920s with the Betty Crocker about how you clean your stove and how you clean your refrigerator. But you know, it is kind of a reminder because we are so busy ourselves. And one of the things about being vaccinated is still the concerns for younger children and younger people. So our human connection and experience and responsibility to each other remains. And I've really noticed that since we've been wearing our masks this winter, I just don't hear all those bronchial coughs like I would when I food shopped. And I don't know anyone that had the flu. Now, this is a terrible way to learn. In the past, we did not wear masks. We did always use our gloves. We did always clean. I have always said when I've opened a case, please make sure paper towels are available to clean the toilet. Please make sure that you explain what cleaning solutions you want used. My grandma, it was always rags, but there was always Clorox, and it was always hung out in the sunshine. But then my grandmother was home, and my mother was home, so when it rained, you gathered the clothes and you put them in the basement. Well, I don't have time for that. So the truth is, we do need to pay attention to the transmission of disease, and that is what OSHA is all about for us, because we already knew about MRSA. We already knew about vancomycin resistant. In fact, we already knew that there were some cases that none of the antibiotics could cure. I had seen some PBS specials of a 14-year-old girl that got MRSA, and it became terminal. But yes, we always tried. You know, we are in a wonderful place where we have excellent medicine here. We're not out in the boonies, wherever they are. So we have the opportunity to get good care. But we know we have our own responsibility to make sensible decisions. So when we listen to Chuck's DVD from UPMC, he's always been such a clear presenter. And when all of you have joined, you've seen it, and every single year you get an OSHA DVD to watch. It's part of our requirements. And now they just really refer to standard precautions. guidelines for preventing exposure to blood, body fluids, secretions, excretions, except sweat, broken skin, or mucous membranes. And we know that people don't have to tell us that they have MRSA. We've had cases where we found out down the road. So of course, because we were careful, and the aprons were a big help too. They have already seen where nurses and doctors who thought they'd wear their lab coat a second day, or maybe the scrubs, that they have seen absolute C. diff and MRSA on them. And I remember as a student years ago at Columbia, we had a microbiology professor, and he said that when he was training the medical students, he used to use like a light on them, like a black light on them, and it would show up any fecal material on their clothing. And he said he had to stop. It got them too upset. I think you would appreciate that, and we would know what he was talking about. It's no fun to empty commodes. I've done it myself. And I thank you for the outreach that you have done through this pandemic, because you've been there. You have still been helping people through it. And I know that they appreciate it. So, and maybe we'll just give some pixie dust to the ones that don't. Based on the concept that body fluids for any client can be infectious, we should use our PPD on every client, no exceptions. I know it's been hard for you because we provide it, but you've got to get here. I know both Kim and I, Bonnie, Sheila say, please call. Please give us some notice because obviously a whole lot is going on in our own lives as well as with yours. And we want to be able to make sure, both Kim and I, when we make those supervisory visits, our form that we have to specifically check off is saying that you're using your PPE. So I don't want to be in a position that I'm a prevaricator. I want to know that we're helping you to do your job. And when there is a particular problem with a particular client, we want to know ahead. I think you all know that we work together as a team. So if somebody doesn't have the money for some things, we do try to help to make it more workable for you. On the plans of care, under the housekeeping chores, there is one that says refrigerator. When I open a case, I say to people that, do they get Meals on Wheels? Then we'll pay attention to rotate the food so that the tuna fish isn't 2 weeks old. Maybe they need a magic marker to help mark those things. If they have something that they've got to be bringing down from the freezer, we do need to keep an eye on the freezer as well as the refrigerator. And if something is obviously spoiled, we do need to throw it out. It's all part of our mission and our sharing and our service. Do you have anything in particular that is OSHA related with some of your current patients that you have any concern about? So pretty much, because see, we're in a lot of buildings like Redeemer Village, Moreland Towers, where there are common areas, common laundries. So, you know, very definitely, you know, your mask needs to be worn and your gloves as well. Because a number of elderly people are incontinent. I know when I washed my mother's clothes, I always wash them separate in hot water. But when we're in these common buildings, we're not sure what some of the other residents are doing. So it behooves us to, you know, be extra careful. I did know one patient that kept Lysol wipes, and she actually, I think she was in Gloria Day Towers, she actually wanted things wiped out with her Lysol wipes, which is fine if somebody asks, but you have your gloves. They're chemicals. I don't want your hands irritated or hurt. And I always encourage everybody not only to be washing, using a nail brush when you can, but to use a moisturizer, because MRSA likes irritated skin. So you don't need any more problems than you already have. Is there any other comment you have about your responsibilities related to OSHA?
I I wipe down phones, doorknobs, the railings, just about everybody's house.
Very good idea.
Good idea.
Yeah, I've seen you do that at
Good idea.
Our Ladies.
Yeah.
And I wiped down the tables, and
Their
I wiped
walkers.
down the arms of the chairs
Mhm,
this morning
mhm.
before you came. Yes.
Yeah.
Good idea for
Yeah.
clients that sit and soil themselves.
Mm-hmm. Yep.
And a lot of clients are bedbound or not moving that much, they don't get up and wash their hands often, so
No,
the
they don't.
surfaces get
Yes.
contaminated. But again, like with COVID, we're dealing with an airborne pathogen.
Mhm.
That is the immediate danger of that, because something that's airborne is, you know, you are always around, you're exposed. They've kind of eliminated a lot of the surface fear that was in the beginning, but in our profession, surfaces can still give you a host of other illnesses. So it's just really important to remember, because COVID, everybody was hyper-focused. And it's nice to relax a little, but at the same time, in this profession, I mean, it's very important that surfaces, that you're being careful, you know, for your own health as well, on those things. And I did forget to mention one thing, that's why we still have to do temperature checks on you when you enter the building, because our children's clinic is a healthcare facility. So healthcare facilities still have to screen people coming into the building. So that is why, I know it can be a little annoying, I'm vaccinated, why do I have to do that, but we do have to screen people when they come in.
And also the thing to remember is that tuberculosis may be lower here, but not so in other places. There are much higher incidences, because again, it's droplet infection. And so that's why on your PPD sheet that you fill out every year, you have to say whether you've traveled to the islands or traveled to eastern parts of Europe, places where they have higher incidence. I mean, usually you don't go for a period of time, but you never know. And we've had cases in Philadelphia where the grandmother had tuberculosis and the family didn't know. She had a chronic cough. And it was the smoking generation, so sometimes they do have a chronic cough, but it's always a wise idea to have a chest x-ray done. And TB can be in the kidneys as well, not just in the lungs. So again, if there's some chronic symptoms in your patients, it's always a good idea to note them, let Kim and I know, and also to mention it to the family, that maybe they should have some further testing. You really are educators. It's a privilege to serve, and you're also ambassadors for us. When I make my visits, I hear a lot of the extra things that you do, and they do appreciate and understand some of the hardships you have as well, with car trouble and the gas, and you know. I have a very lovely person on my team who recently was hospitalized for a flare-up of asthma for 3 days. So, and I have others on my team that definitely have medical situations that they have to deal with and attend to. We want you well. You know, you can't help other people if you aren't well yourself. And certainly, air, pure quality, water quality. I belong to Sierra Club because I believe that you and your children and your grandchildren need clean water and clean air. I think that COVID has emphasized that even more, that we have really work to do here together. And I thank you for just being part of our outreach. So thank you for coming this evening.